Microphone check 1 2 1 2. Come check me out, y'all. Come on in. My guest is here. We had some technical difficulties earlier. Technical difficulties. We are back. Testing 1 2 3. Y'all up in here? All righty. I see you, TP. I'm waiting on my other guests. Y'all bear with us. Come on in. Y'all come on in. Just giving a moment for my other guests to get on in here. I hope you guys are enjoying y'all Friday night because it was a long week. It was a long week, y'all. Y'all come on in. I'm just giving everybody a moment to get on up in here. All righty. All right, there we go. There we go. My guests are here. All right, y'all. We got TP. She is, in fact, my cancer survivor. And we also have her sister in here, Lisa. I want y'all to welcome them in. I'm just giving everybody a second to come on in and join us. Tonight's conversation will be surviving cancer, breast cancer. So how you doing, TP? And how are you, Lisa?
Great. How are you?
All right now. Y'all, I want you guys to know that this is her sister who has been very supportive and by her side. So we want to make sure we welcome her in and pay our respect to her as well. Yes, indeed. So as you guys know, breast cancer, there is a mammogram that's done, which is an x-ray of your breast, which it detects abnormalities like masses, okay, tumors, cysts, lumps, etc. And its idea age to start getting those tests would be 30. But you can start even earlier than that. That's just idea age. Okay. Women 40, 49 and over, it's good to be checked for it at least every year to 2 years. It is very important. Very important. So we're going to start with some questions, y'all. So, TP, when were you diagnosed with breast cancer?
I was diagnosed in 2001.
2001. And how did you feel in that moment of you being told that you had breast cancer?
Unbelievable. I was 40 in the prime of my life. I wasn't trying to hear that, but I had to deal with it. And at that
A-
time, it was you supposed to have your test at 45, but they changed that age now.
And so what um what was like your biggest challenge during your treatment?
My biggest challenge was going in there and seeing women who was much older than me because at the time, 2001, that's 24 years ago. So you think of things differently. And especially I was 40, so there's no way that this got me. But of course, it gets the best of us. But just seeing older women coming in and me just not believing that I was a part of that group.
Right, right, absolutely. And like how did your cancer diagnosis affect your family?
Well, it hit them seem like a little harder because, I'm like almost the backbone of this family. So they all were right with me, helping me out, being a encouraging voice factor for me, keeping me positive.
That's beautiful because I know that is very, very, very important to
Yes.
have a support system. And Lisa, I want you to jump on in there too, if you don't mind if I ask you that same question. What was it like upon finding out that your sister was diagnosed with breast cancer?
Well, for me, it was harder, much more so than I think even for her, because you always think about possibly, like the worst of what could possibly happen. But with her, she's always positive. She don't like to burden anybody, so she's gonna handle it. She's always like that strong one for everybody. So it's kind of hard sometimes, even though she's going through something, to kind of even read her to understand what's going on. You have to really keep prying for her to open up because she always feels she got to stay strong, and that's just who she is.
That's right. That's
So it
right.
makes
And like, what do you feel was like most important for her in that moment, being her support system?
just trying to stay positive and encouraging for her and let her know, that you're there for her.
Same question with you, TP. What was like most important for you um in that at that time? What was most important for you being diagnosed with cancer as far as your support? What was like most important?
For them not to come around and I don't see them looking sad face like I was getting ready to die. For me, I didn't want them to bury me before I had a fight. So I had to show them that that's not going to get me. That's what the doctor said I had, but the main doctor told me something different.
That's right. That's right. And Lisa, did you like take care of her home needs and everything?
Unfortunately, I don't live in Michigan, so I'm actually in Nevada. So my more or less support was my support was pretty much like on the phone talking to her and that type of thing.
Okay. Okay.
And sending me whatever I thought I needed. Things I didn't even think that I wanted, she was sending it.
Say she was a very good support system. That's all right because you know what? I just being diagnosed with breast cancer and any cancer, I couldn't imagine not having a support system. I mean, that would make it even harder. You know what I mean? So
Of course.
just hearing that you had a support with Lisa is beautiful. Did you feel supported by your other family members?
I did.
That's wonderful. So you have a big support system.
I had a huge support system,
That's a
friends as
blessing.
well.
All right, now I love to hear that because again, whatever challenges that you're going through in life, and I can only, breast cancer being one, it's just beautiful to hear that because there's a lot of people that didn't have a support system. So, to anyone listening, that would be very important being a breast cancer survivor. Am I right, TP?
You're absolutely right. Then you have to think of the the questions that come. So you can have a lumpectomy, it's just taking just that little piece of the cancer out. You can have a mastectomy, which taking the whole breast off. So you have to deal with what decision you're gonna make. You gotta also think about, they tell you you're gonna have doctors come to you after your surgery, which they supposed to do. So they're gonna ask you, you're gonna do chemo. That's what the chemo doctors do. You're gonna ask for the radiation. That's what they do. So I had to ask my doctor because I didn't know what to do. Which one should I have? And so he said, "Well, that's your decision." I said, "Well, if this was your family member, what would you suggest that they have?" He said, "Well, I would just say do radiation because yours was caught very early." I said, "Well, will my hair fall out?" He said, "Well, you take the chemo, yeah, your hair fall out." So being a little on the vain side, I was like, well, I think I'll just do the radiation since he already told me that that was going to do it. So that's what I took, the radiation.
All right, you took the radiation and you survived it. You made it through, and that is such a blessing. It really is. Were you dating at the time or married?
I was dating.
And how was that? Did you feel like you were being supported by whom you were dating?
I was dating a guy and I was 1000% supported. So when I told him that I had breast cancer, and I don't have much breasts anyway, so I told him, I got to tell you something. Like what? I said, the doctor told me I got breast cancer. He's like, what? And then I was still in my feelings. So I was like, I got to call you back. I hung up, cried a little bit. But he called me right back. And he says, but wait a minute. Didn't you say breast cancer? I said, yeah. He said, but wait, don't you got to have breast to have breast cancer? And I laughed real hard. And I was straight after that.
Well, you know what? Just the fact that he stood by your side and he fought through that with you says a lot about him. It
Yeah,
does. It does. And I will hope that he see this because we are personally shouting you out. You hear me?
yeah.
Personally shouting you out. And as we know that a lot of the risk factors, as they say, excessive hormone use or hormone replacement, like birth control pills can increase the risk, alcohol, some radiation therapy, certain medications, obesity after menopause. But we also know that genetics play a role. It also can be family history. Was there like any of those that I named off thus far that what was your cause?
I had no family member. I had a sister after I was diagnosed. And we have to be careful when we go to doctors. So my sister had a stroke and she already had sister's breast anyway. And she kept complaining about her breast, her breast, her breast. I said, Charlotte, you don't keep complaining about your breast. They're going to tell you got breast cancer. I doggone, I was right. So she had breast cancer and she chose, well, they chose for her having a stroke, a mastectomy, because they have a drainage tube and her tube wasn't working for her since her breast cancer was on It was on her left side. She had the stroke on the right. No,
Mm,
she had the stroke on the left. The breast cancer was on the right. So she had to maneuver trying to do the tube, and that was her election on her therapy was a mastectomy because that worked best for her. But mine was so small. You got to remember, early diagnosis the best. Mine was the one that they say I had because I don't claim that was
that's right.
small. So that's why I chose the radiation.
And as far as your doctors, um, if there was any hospital stays, were there ever any hospital stays?
Nope, I did same day surgery, went home. I had about 10 people there with me. When I first went in for them to just tell me that what was going on, I have a big family. I had about 11 people in that little bitty room, and they was always there to support me. So that is the biggest thing for anybody dealing with any type surgery or anything going on with them, especially like cancer. Because at one point we all know that that was a death sentence, but it's not anymore with
Yes.
early detection.
Yes, absolutely. Absolutely. That's why it's very important as women that we are checked constantly. We are always, we stay on top of that as far as our health is concerned. There's a lot of women that, will feel a lump and they'll be afraid to go and see what it is, because they're too afraid to, hear that it's a possibility that they have a tumor or anything. What do you say to those women?
Those women have to understand it is not like it used to be. A lot of people don't like going to the dentist because it hurt, but it's not like that anymore. Technology is so different when you go for any type thing. Some people don't like to get blood drawn. It's
That's
different now.
right.
Not the big crazy needle anymore. So it's just early detection on everything. You choose to live, you take care of yourself. I chose to live. Still choose to live.
That's right. That's right. That's right. I love that. I love that. Your story alone, I'm sure, I'm positive is going to touch a lot of women that may be dealing with this, a family member may be dealing with this, and just knowing you know, you went in, like you said, it was early on detection and you got diagnosed early and you made it through. I mean, that's a testimony itself.
Yes.
So I applaud you for being strong. You are a survivor. And I'm sure that anybody listening to this right now can agree with me when I say, shout out to you, sister, because you did that. Okay.
Yeah.
Shout
And just
out to
because you don't
you.
have that in your family doesn't mean that you don't have that you won't be a person that get cancer. It's just always best to be checked.
That's right. That's right. Even when we speak on environmental, they say that, like, again, too much exposure to chemicals, and you got to watch those pesticides and plastics and red meat. And as we recall, Dr. Sebi told us that the sugar actually feeds the tumor.
That's true.
So that's a lot to think about. That's a lot to think about, and we have to stay on top of it. We have to, because some didn't make it through. It's people listening now that lost a family member, lost someone that they loved, a friend, a family member. you know so we have to stay on top of it. Anything that you'd like to say, Lisa? Just being her family member and being by her side and watching her be strong and make it through. I mean,
That's
wow, right?
right. It's a blessing. Because, like you
Yes.
said, it could be, so much worse. But, two, also the fact of her just being positive and really, fighting that fight for family, in a sense, it kind of made it where, because at first, like I said, you're feeling really, you don't know, so you're thinking the worst. But she gave us enough to make us see that, she was going to be okay.
That's right.
And that, in a sense, for those that are being that support system, it's encouraging to you as well. And
Hmm.
it's unfortunate a lot of people don't have that.
That's
That's
correct.
right. That's right.
So
That's right.
it's a blessing when you have people that's basically in your corner and they're positive. Because sometimes you have people in your corner that's not positive, and that doesn't help anything.
That's
Mm-mm.
right.
Be
That's
it
right.
breast cancer, any kind of just illness overall, that positive makes a difference. And then, well, like I said, looking at her and seeing her being strong, it helped us as well to understand that, it's definitely could be worse. But, she was fighting the fight, and we are going to fight that fight with her.
That's
That's right.
right. Amen,
Mhm.
amen, amen. Okay. Now, what words of like wisdom or advice would you all give to women facing facing cancer, being diagnosed with cancer, breast cancer, or any cancer of that sort?
I would say breast cancer is not just for women. Men get breast cancer as well. And right now, it's on a high level. And it's very good to read and research. I like researching, just watching everything. Now, there's a lot of men that get breast cancer. You just don't hear it as often because it's the men who makes these machines that torment us when we having those mammograms, when you having PEPs smears. Is the men that makes these crazy gadgets for us, so they don't really have to go through what women go through, and they don't talk about it like women do about what's wrong with us. But men get breast cancer at a high rate as well.
Teach us. All right, y'all hear that, men? It's important that we as human beings stay on top of our health. Okay, because when we start talking about cancer, it is a very broad conversation of many different cancers, you know, colon cancer, breast cancer, lung cancer, and so on. So we really have to be adamant about, you know, staying at our doctor. If you feel like something is wrong, it's better to go and check it out so you can find out early on and have that fighting chance versus waiting and being afraid, and the next thing you know, it's a spread happening through your body. You know, you give yourself a fighting chance when you just get in there, be brave, and find out what's going on with yourself. Because if you can't see about you and you not okay, you can't do nothing for anybody else.
Absolutely. And
That's
there's a
Okay.
true.
saying that says, if you see something, say something. It's the same if you feel something, do something.
That's right. That's
Mhm.
right. That's right. Well, I would definitely like to thank you, TP, and you as well, Lisa, for blessing my YouTube today. Lisa, you being a supporter, a great supporter, her sister, and TP, you being a survivor. I just want to take my hat off to you because just hearing your story and hearing how brave you were and hearing how you stayed positive, I say a lot of times what we put out and what we say, it returns to us. And the fact that you kept that positive attitude and you said, you know what, I may be hearing this, but not me. I don't have this. I'm gonna make it through this.
Mm-mm.
So
I
we could
don't
just
claim
go.
that mess.
That's right.
I let them take that little piece out, but I ain't had that. Okay.
Okay, come on now.
That
So
ain't my
yeah,
journey. That's just one of them.
that's right. That's right. That was your journey, and like I said, you made it through. Any last words you guys would like to offer? Because I don't want to hold you long. I know it's getting late, and we had some difficulties, but I appreciate you guys coming up here again, blessing my YouTube. I see some chat members here. Hey, Close Casket, I see you. Shayla, I see you. Emily, I see you. Deontay, I see you. Dre, thank you all. If I missed anyone and whom I may have missed for coming on in and checking us out. And you guys drop some flowers in the chat because they definitely deserve it. TP deserves it from being a survivor, and Lisa just being that supportive family member. And shout out to her family members that come across this audio. I want to thank you all for being supportive. Because it's nothing like having family that supports you through your hardships. or whatever you going through for that sort, right?
Absolutely.
Exactly.
OG, I see you. OG says strong women, strong woman, TP. That's right.
Thank you.
Yes, absolutely. And I want to thank you all. And I'm gonna let them get out of here. We'll also have some more, I'll have some more guests coming up. And y'all stay tuned for that. And upon me leaving, and upon us all leaving, I want you all to just hug somebody you know that's dealing with a diagnose. Let them know that you're there. As you heard TP say, as you heard Lisa tell you all, that is the most important thing. Okay. So if you guys happen to know anybody that's living with a diagnosis right now and they're battling and they're fighting, just let them know you there. Give them that support. And to those that lost someone in a battle, my heart goes out to you. Okay. And I want you to know that my heart goes out to you. Is that right, ladies?
One last
That's
word. You
right.
know where you've been, but you don't know where you're going.
That's right. That's right. And y'all know, as usual, I had to come in here and sit with you all. I want y'all to put the needle on the record and spin these audios. And until next time, y'all know the vibes. Peace. And thank you guys for coming out. Thank you, TP, and thank you, Lisa.
You're
Thank
welcome. Have a
you.
beautiful night.
All right now.
Take
Bye bye.
care.
Bye bye. All right, chat. We're going to get out of here. And again, thank you all for coming on in and just welcoming them in. That's not an easy conversation to have. And I am just so grateful that they showed up and showed out, did wonderfully. Some good questions and good answers out there, some things that people need to know in general. It's just far as what you need, what you need to do and what you need as far as that support system. Thank you all for coming out and checking us out. Y'all take care and enjoy the rest of y'all Friday now. Peace.